I guess I usually try to start with a humorous line, "I'm going to be a sleepy doctor." And it usually brings a smile on the patient's face. However, I guess probably your question was to non-anesthetics friends or to the patients. I usually start with introducing myself that I am there to assist them through their journey. And the journey does include several components, and making sure that they are safe, comfortable, pain-free through the anesthetic is probably the biggest role I play. As an anaesthetist, the journey starts as a pre-anesthetic assessment. We usually spend a bit of time assessing the suitability of different types of anesthesia that we can provide relating to the particular surgery they're going through. Then we spend some time explaining the usual techniques that we would be following through the interventions or the procedures, and then obviously explain to them that one of the anesthetists, either myself or one of my team members, will stay with them throughout their journey on the operation table to make sure that they are safe. Also ensuring that they wake up in a smooth manner, they are comfortable. A couple of things that are very common when patients do wake up include post-op nausea, vomiting, and pain. So ensuring that we start managing these well before the patients are awake makes the journey smooth, and that's what we are there for. A typical workday would usually start with going through the list of the patients which have been scheduled on the list. Making sure that if there are some patients with high comorbidities, get a detailed bedside assessment. So that's probably where the usual day will start. I'll go either to the ward or the pre-assessment areas, spend some time explaining to the patients what the day will entail. Usually work in a team, so we have an anesthetic nurse, anesthetic technician, and usually the luxury of an anesthetic registrar in theatre. We all have a bit of a huddle in the morning to make sure we understand our roles, what we are going to be going through the day. At that time, we also try to do a bit of a distribution of workload, ensuring that there are no obstacles in the smooth running of the day. Then usually around 7:30 to 7:45, the first patient is brought to the operation theatre, and depending on the type of surgery, depending on the grade of surgery, putting in cannulas, lines, making sure all the routine anesthetic and resuscitation drugs are available, making sure the anesthetic machine has been checked. That's where the typical day starts. And truthfully, I don't think there's a typical day for an anesthetist. Every day is different. Every day comes with its benefits and challenges. A very simple procedure can become very complex suddenly, and so we have to be prepared with these things. The end of the day obviously is undetermined. A 1-hour surgery can go to a 4-hour surgery, and a 4-hour surgery can be a half-an-hour procedure. So when we will finish, it all depend on how the surgical list proceeds. We also have a very smooth running system in our operation theatres that in case assistance is needed, there is enough staffing on the floor to go to the other theatres and assist other people when the complex cases do come. So every day is different. Team that we work with. So working alone in silos is probably not my cup of tea. The advantage of working in theatres is that there's a surgical team, there's a nursing team, there is an anesthetic team, and working together, having a bit of a fun when things are going smooth, and being ready for any challenges is probably the best part of the day. As I said earlier, almost always, "I'm going to be a sleepy doctor" starts a good conversation. However, another thing that we have kind of with time we learn is that everybody comes with a different expectation. Trying to understand why they are anxious, is their first experience or is there have been a previous mishap in their journey, identifying those, addressing their concerns, holding the hand, putting a smile. All these things are usually very helpful in ensuring that they have a bit of a good collaborative relationship with them and helping with calming their anxiety. And at the end of the day, medications always help. I think 2 common questions. One is more of a comment: make sure I go to sleep before the surgeons come close to me. And the second one, when people are anxious, are you sure I will wake up? I guess when it comes to making sure that they are asleep, we say let's do a counting. Some people like reverse counting, and we say that okay, I've never lost a race, start with 10. If you can reach 1, I'll accept my loss, but have yet to come across a person who wins a race against most of the anesthetic medications. When it comes to waking up, obviously again, is there an element of anxiety or they're just wanting to be a bit more sure? We reassure them that yes. And another joking thing that we try to utilize is that say, if we don't wake you up, the paperwork is too difficult, so we'll better wake you up. Asking questions at the right time, starting from when you are being scheduled for surgery, asking the surgeons any questions is an important starting point. We usually include a lot of information leaflets that are given to the patient, going through their information leaflets well in advance, making sure that you understand what medications need to be stopped pre-procedure, making sure that you understand the fasting instructions. Sometimes, yes, there is instruction that you fast from the night before. However, at times when the surgeries are scheduled in the afternoon, the advice is to usually have something in the morning, making sure you understand your timings, making sure that you keep yourself hydrated, because dehydration doesn't help in finding the veins. So all these things are very important.